NHA CCMA quiz practice. Question 1. A patient presents with a pulse rate of 110 beats per minute. Which medical term should the medical assistant use to document this finding? Option A, bradycardia. Option B, bradypnea. Option C, tachycardia. Option D, tachypnea. The correct answer is option C, tachycardia. Tachycardia refers to a heart rate greater than 100 beats per minute in adults. Bradycardia is a rate below 60 bpm. Bradypnea and tachypnea refer to abnormally slow and fast respiratory rates, respectively. Question 2. A medical assistant is coordinating a specialist referral for a patient with severe osteoarthritis. What information must be verified before the patient's appointment? Option A. The patient's credit history and score. Option B, prior authorization from the patient's insurance company. Option C, the specialist's personal cell phone number. Option D, the patient's driving record for transport purposes. The correct answer is option B, prior authorization from the patient's insurance company. Many insurance plans require prior authorization before specialist visits to confirm medical necessity and ensure the referral is a covered benefit. Failure to obtain prior authorization may result in claim denial and unexpected out-of-pocket costs for the patient. Question 3. A medical assistant observes that a hematoma is beginning to form rapidly during a venipuncture. What should be the assistant's immediate action? Option A, adjust the depth of the needle to stop the bleeding. Option B, advance the needle further into the vein. Option C, remove the tourniquet, withdraw the needle, and apply pressure. Option D, have the patient pump their fist to redistribute the blood. The correct answer is option C, remove the tourniquet, withdraw the needle, and apply pressure. Hematoma formation indicates blood is leaking into surrounding tissue, likely because the needle has exited the vein. The correct response is to release the tourniquet immediately, withdraw the needle, and apply firm pressure to minimize bruising. Advancing the needle worsens the injury. Question 4. According to developmental psychology stages, a child who is experiencing a conflict between industry versus inferiority is typically within which age range? Option A, 1 to 3 years old. Option B, 3 to 6 years old. Option C, 6 to 12 years old. Option D, 12 to 18 years old. The correct answer is option C, 6 to 12 years old. Erickson's stage of industry versus inferiority occurs during middle childhood, ages 6 to 12. Children in this stage are learning to master academic and social skills. Failure to develop competence leads to feelings of inferiority. Question 5. A medical assistant is preparing to assist with a punch biopsy of a skin lesion. Which of the following instruments should be included on the sterile tray? Option A, tenaculum forceps. Option B, biopsy punch and iris scissors. Option C, speculum and obturator. Option D, curette and uterine sound. The correct answer is option B, biopsy punch and iris scissors. A punch biopsy tray includes the cylindrical biopsy punch tool, iris scissors to cut the base of the core sample, forceps, a specimen container, and local anesthetic supplies. Tenaculum and uterine sounds are gynecological instruments used for intrauterine procedures. Question 6. Which of the following fasting blood glucose results falls within an abnormal, pre-diabetic range for a non-diabetic adult patient? Option A, 65 mg/dl. Option B, 85 mg/dl. Option C, 115 mg/dl. Option D, 145 mg/dl. The correct answer is option C, 115 mg/dl. ADA criteria define prediabetes, impaired fasting glucose, as a fasting blood glucose of 100 to 125 mg/dl. Normal fasting glucose is below 100 mg/dl. A result of 126 mg/dl or higher on 2 separate occasions meets the diagnostic threshold for diabetes mellitus. Question 7. When applying a surgical dressing to a wound, which of the following layers is intended to be sterile and come into direct contact with the wound bed? Option A, outer elastic wrap. Option B, primary dressing. Option C, secondary tape layer. Option D, ABD pad reinforcement. The correct answer is option B. Primary dressing. The primary dressing is the layer placed directly on the wound surface and must be sterile to prevent infection. The secondary dressing overlies it for absorption and protection. The outer wrap provides compression and secures the layers. Question 8. A 6-month-old infant is brought to the clinic for a well child checkup. How should the medical assistant measure the infant's length? Option A, hold the infant upright against a wall-mounted tape measure. Option B, place the infant supine on a measuring board and extend the legs fully. Option C, wrap a flexible tape measure around the infant's torso and limbs. Option D, mark the paper on the exam table at the crown and heel while the infant is prone. The correct answer is option B. Place the infant supine on a measuring board and extend the legs fully. Infants under 2 years are measured in the recumbent, supine, position using an infant measuring board to ensure full extension of the legs. Standing height is measured only once the child can stand steadily, typically after age 2. Question 9. What angle of insertion should be used when performing a venipuncture with a standard multi-sample needle? Option A, 5 to 10 degrees. Option B, 15 to 30 degrees. Option C, 45 to 60 degrees. Option D, 90 degrees. The correct answer is option B. 15 to 30 degrees. Venipuncture is performed at a 15 to 30 degree angle, with the bevel facing up, to allow smooth entry into the vein lumen without passing through the posterior wall. A shallower angle is used for superficial veins, steeper angles risk through puncture. Question 10. When answering an incoming telephone call at a medical office, which of the following greetings is most professional? Option A, hello, please hold. Option B, good morning, Northside Clinic, this is Alex. How may I help you? Option C, doctor's office, who is calling? Option D, yeah, this is the clinic, can you wait a minute? The correct answer is option B. Good morning, Northside Clinic, this is Alex. How may I help you? A professional telephone greeting includes a salutation, the office name, the staff member's name, and an offer to assist. This establishes credibility and creates a positive first impression. Placing a caller on hold before identifying the office is rude and unprofessional. Question 11. When coding an office visit encounter, which code set is used to report a provider's diagnostic evaluation and clinical decisions? Option A, CPT codes. Option B, ICD-10-CM codes. Option C, HCPCS Level 2 codes. Option D, modifier codes. The correct answer is option B. ICD-10-CM codes. ICD-10-CM, International Classification of Diseases, 10th revision, clinical modification, codes are used to report diagnoses, conditions, signs, and symptoms. CPT codes describe the services and procedures performed. Both code sets must be included on a complete claim. Question 12. A medical assistant is assembling equipment for a venipuncture. What is the standard order of draw for a complete blood count, CBC, and a routine chemistry panel? Option A, lavender tube first, then tiger top, SST, tube. Option B, tiger top, SST, tube first, then lavender tube. Option C, green tube first, then light blue tube. Option D, light blue tube first, then lavender tube. The correct answer is option A. Lavender tube first, then tiger top, SST, tube. CLSI order of draw places the EDTA, lavender, tube before serum separator tubes, SST/Tiger top, when no light blue coagulation tube is needed. If a light blue tube is ordered, it precedes the lavender. The correct order prevents additive carryover that could alter results. Question 13. A patient is non-compliant with their hypertensive medication because they do not understand why they must take a pill when they feel fine. What action should the medical assistant take? Option A. Inform the patient that they will be dismissed from the practice. Option B. Provide educational materials explaining asymptomatic hypertension. Option C. Tell the patient to double the dose when they feel stressed. Option D. Document the non-compliance and ignore the issue. The correct answer is option B. Provide educational materials explaining asymptomatic hypertension. Hypertension is often asymptomatic until it causes end organ damage, so patient education explaining this concept is essential for compliance. The medical assistant should provide appropriate materials and notify the provider. Dismissing or ignoring non-compliance is clinically and ethically inappropriate. Question 14. What is the preferred injection site for an intramuscular injection administered to an infant? Option A. Deltoid muscle. Option B. Dorsogluteal muscle. Option C. Vastus lateralis muscle. Option D. Ventrogluteal muscle. The correct answer is option C. Vastus lateralis muscle. The vastus lateralis, located on the anterolateral thigh, is the preferred IM injection site for infants and toddlers because it is well developed and free of major nerves and vessels. The deltoid is used in older children and adults. The dorsogluteal site is avoided in infants due to proximity of the sciatic nerve. Question 15. A medical assistant is placing electrodes for a standard 12-lead electrocardiogram, EKG. Where should the electrode for lead V4 be positioned? Option A. 4th intercostal space at the right sternal border. Option B. 4th intercostal space at the left sternal border. Option C. 5th intercostal space at the left midclavicular line. Option D. 5th intercostal space at the left anterior axillary line. The correct answer is option C. 5th intercostal space at the left midclavicular line. V4 is placed at the 5th intercostal space at the midclavicular line on the left side. V1 is at the 4th ICS right sternal border, and V2 is at the 4th ICS left sternal border. Accurate precordial lead placement is critical for detecting ischemia and infarction patterns. Question 16. A medical assistant notes a prescription for a Schedule II controlled substance. Which of the following is a characteristic of Schedule II drugs? Option A. They have no accepted medical use in the United States. Option B. They have a high potential for abuse but are accepted for medical treatment. Option C. They can be refilled up to 5 times within a 6-month period via phone. Option D. They carry a very low risk of physical or psychological dependence. The correct answer is option B. They have a high potential for abuse but are accepted for medical treatment. Schedule II drugs have a high abuse potential with severe psychological or physical dependence risk, yet are accepted for medical use with strict prescribing controls. Schedule I drugs have no accepted medical use. Schedule II prescriptions cannot be called in by phone or refilled. Question 17. A medical assistant is applying a cold compress to a patient's sprained ankle. How long should the compress remain on the skin to prevent tissue damage? Option A. 5 to 10 minutes. Option B. 15 to 20 minutes. Option C. 40 to 45 minutes. Option D. 60 minutes. The correct answer is option B. 15 to 20 minutes. Cold therapy should be applied for 15 to 20 minutes per session to achieve therapeutic vasoconstriction and reduce inflammation without causing tissue damage such as frostbite. Application beyond 20 to 30 minutes can lead to paradoxical vasodilation and skin injury. Question 18. A patient presents with symptoms of an upper respiratory tract infection. Which of the following structures is part of the upper respiratory tract? Option A trachea. Option B bronchi. Option C pharynx. Option D alveoli. The correct answer is option C, pharynx. The upper respiratory tract includes the nose, nasal cavity, pharynx, and larynx. The trachea, bronchi, and alveoli are all components of the lower respiratory tract. URIs commonly include the common cold, sinusitis, and pharyngitis. Question 19. A patient has been diagnosed with a reportable communicable disease, such as tuberculosis. To which agency is the medical office legally required to report this information? Option A. The Centers for Medicare and Medicaid Services, CMS. Option B. The local or state public health department. Option C. The Occupational Safety and Health Administration, OSHA. Option D. The Joint Commission. The correct answer is option B, the local or state public health department. Reportable communicable diseases must be reported to the local or state public health department as required by state law and CDC guidelines. This reporting enables disease surveillance, outbreak investigation, and contact tracing to protect public health. Question 20. Which of the following topical wound treatments is commonly used to debride non-viable tissue from a partial thickness burn? Option A hydrocortisone cream. Option B silver sulfadiazine. Option C isopropyl alcohol. Option D hydrogen peroxide solution. The correct answer is option B, silver sulfadiazine. Silver sulfadiazine is an antimicrobial cream widely used on partial and full thickness burns to prevent infection and assist in wound debridement. Isopropyl alcohol is cytotoxic to healing tissue and should not be used on open wounds.